Postpartum hemorrhage, also called PPH, is excessive bleeding after childbirth. It is a medical emergency, but it can often be prevented and treated when recognized early and managed quickly. The first 24 hours after birth are especially important. Heavy bleeding can also occur later, during the days or weeks after delivery. Never assume that severe bleeding is simply a normal part of recovery. After the placenta separates, the uterus should contract firmly. These contractions squeeze the blood vessels that supplied the placenta. If the uterus remains soft and does not contract well, heavy bleeding can begin. This is called uterine atony, and it is the most common cause of postpartum hemorrhage. Health professionals often remember the causes using the 4 T's. Tone means the uterus is not contracting. Trauma means a tear or injury in the cervix, vagina, perineum, or uterus. Tissue means part of the placenta or a blood clot remains inside the uterus. Thrombin means a problem with the blood's ability to clot. Postpartum hemorrhage can happen to any woman, including a woman with no known risk factors. The risk may be higher with anemia, twins, or another multiple pregnancy, a very large baby, prolonged or very rapid labor, an overstretched uterus, infection, previous postpartum hemorrhage, cesarean birth, assisted delivery, or problems with the placenta. The clearest warning sign is heavy or continuous vaginal bleeding. Blood may gush, soak pads rapidly, or contain large clots. Other danger signs include a fast heartbeat, dizziness, fainting, severe weakness, pale or cold clammy skin, confusion, shortness of breath, worsening abdominal or pelvic pain, and swelling or severe pain around the vagina or perineum. At home, call for emergency medical help immediately. Do not wait to see whether the bleeding stops. Keep the woman lying down and warm while arranging urgent transport to the nearest appropriate health facility. Do not give medicines or insert anything into the vagina unless instructed by a qualified health professional. In a health facility, the team acts at the same time to identify the cause and stop the bleeding. They call for help, assess breathing and circulation, measure blood loss, check vital signs, massage the uterus when appropriate, give medicines that help the uterus contract, administer tranexamic acid when indicated, start intravenous fluids, examine for tears and retained placenta, and arrange blood transfusion when necessary. If bleeding continues, a uterine balloon may be used to apply pressure from inside the uterus. Further procedures may include removal of retained tissue, repair of tears, compression sutures, blood vessel procedures, or surgery. These interventions must be performed by trained professionals following local clinical protocols. Prevention begins during pregnancy. Attend antenatal care, test for and treat anemia, take prescribed iron and folic acid correctly, discuss previous heavy bleeding or placental problems, and make a birth plan that includes skilled care and emergency transport. During childbirth, trained health workers use recommended uterotonic medicines and closely monitor the mother after delivery. After leaving the facility, the woman and family should know the danger signs. Seek urgent care for bleeding that becomes heavier instead of lighter, soaking pads very quickly, large clots, faintness, racing heartbeat, fever, worsening abdominal pain, offensive smelling discharge, difficulty breathing, or a strong feeling that something is seriously wrong. Postpartum hemorrhage is time critical. Early recognition, rapid referral, teamwork, and evidence-based treatment save lives. Share this video with pregnant women, partners, families, and birth companions. Subscribe to Healthy Living Hub for practical health education. This video provides general education and does not replace assessment by a qualified health professional.